Thanks, Laurie. So I'm Dr. Maryam Abdool-Richards, and I'm here. I came in from Trinidad and Tobago. I'm very, very happy to be here today. This is my second Cayman Islands Health Conference. I was here 2 years ago and thoroughly enjoyed it, and I could not miss the opportunity to be back here today. So today I'm going to just speak about looking forward a pathway to resilient healthcare systems, which ties into the theme of today's conference. Yes, so looking forward a pathway to robust healthcare systems. So I'm going to start the discussion today about looking at healthcare resilience and why is healthcare resilience important to the Cayman Islands and as applied to the Cayman Islands Climate Change Policy 2024 to 2050. Just highlight some policy focus areas and then look at some climate resilient approaches as applied to the health sector, some current and future suggestions based on what I've seen across the region and in Latin America. So there are a lot of suggestions and considerations that would be discussed versus just highlights, but of course the policy provides the backbone for the discussion. Healthcare resilience. We're speaking about sustainability and healthcare sustainability, sustainable healthcare systems. And resilience actually is a key component of any healthcare system because resilience ensures agility of a healthcare system to withstand shocks. And we would have all seen that as healthcare professionals during the COVID-19 pandemic. Resilience is about agility. It's about being able to be flexible, being able to pivot, being able to retrofit our health centers, retrain our doctors, and take skills that are different during an emergency mode. That's the nature of our job as healthcare professionals. Resilience is also key in looking at new and re-emerging viruses. We would have seen, for those of us who are in infectious diseases, the threat of chikungunya, dengue, etc., new variants, especially in Trinidad and Tobago and the Southern Caribbean, humanitarian crises, security threats, and the impact of climate change. Now, we speak about disaster management activities, but healthcare resilience is more of a proactive approach and measure. And really, in this discussion, we are looking at mitigating the impact of climate-induced changes. In the Caribbean, climate change is now one of our most significant public health problems. And in the Caribbean, we are net receivers of climate change. We are receivers, so we have to adopt and adapt. Even the energy-producing countries in the Southern Caribbean, like Trinidad and Tobago, Guyana, and Suriname, Aruba to an extent, even in our countries, if we were to reduce CO2 emissions, it would not really make a dent in terms of what is going on in terms of climate change. So we have to adopt and adapt and understand the capacities of our healthcare systems and the resilience that is required. As climate change intensifies, we face rising threats, and it depends on our islands, but we all face rising threats from extreme weather, sea level rises, and of course, disrupted service delivery. We just need to think about flooding, and I'll share with you that in Trinidad and Tobago, which I don't know how many of you would have visited, once there is rain for more than 20 minutes, which generally, because we are closer to the equator, we're just about 11 degrees north, once there is rain for 20-25 minutes, Port of Spain floods and the entire city gridlocks. There's a pattern of rain in Trinidad that falls around between 1 and 4 p.m. So guess what happens around 1 p.m. when it rains? And this is climate change. This didn't happen 20 years ago. Guess what happens? It rains and there is this mass exodus of persons and the roadways get totally blocked. And to drive probably 20 kilometers, you might take 3 hours. I was stuck in it recently just because of the threat of the rain. And that has a lot to do with climate change. So it disrupts business as well. Building resilience in this context calls for reimagining health infrastructure, delivery models, and facility design to withstand and adapt to environmental shocks. So it's not just about clinical health and looking at climate-induced medical conditions, but it's also about looking at the entire healthcare system and where the shocks are. And I mean, as a physician, I was really impressed yesterday with all the presentations, but especially Dr. Kumar's presentation, where he looked at all the interlinkages between primary healthcare and wellness and holistic medicine. And that really struck a chord with me because I am a primary care specialist and I'm also a public health specialist. So I did both. So I'm one of those doctors who would have seen patients and individual patients in rural health settings, in urban settings, city settings, and then had to manage a population. So when we speak about resilience, it's not just about looking at what are the measures that we can have in terms of climate change in our buildings, but how do we adapt our clinical models in terms of healthcare? So especially in the Cayman Islands, and as a small island developing state, there are significant threats and potential disruptions, especially in the key revenue-earning sectors such as tourism and infrastructure, and of course financial services. Because if our health systems are not resilient, the country becomes less attractive. I'll put it simply as that. So there's a loss of competitive advantage. Expatriates want to know that there is a resilient healthcare system in place. So it becomes now a competitive advantage and a point of attractiveness for businesses, for persons who are moving, for tourism, and so on. Severe climate change risks in this country include, of course, infrastructure vulnerability, ecosystem degradation, which will impact on your tourism, energy disruptions, and of course, a decline in the tourism sector. Now, at this point, I'd just like to delineate two concepts, the concepts of health and healthcare, because you'll hear me referring to both words, or both areas. So there's health and healthcare. Health is that WHO definition that encompasses physical, mental, and social well-being. It looks at how you feel. Some people add spiritual as well in there, if you are so inclined. But when I speak about healthcare, we're looking here at the health system's components. We're looking here also at the antecedent factors. And as healthcare professionals, we are all aware of the health system's building blocks. So when we look at healthcare, we are looking at things like what is the financing mechanism that is being employed to finance this healthcare system? What is the human resource strategy that is going to be used to ensure that this healthcare system is now resilient? What are your digital transformation measures, and how are you protecting them in terms of climate resilience? We are also looking at supply chain and logistics, and I'd also add health infrastructure in there, because that's one of growing concern and importance. Now, this is the health part. So I did highlight the health aspect, because that will come along when I speak about financing. So these are climate-sensitive health risks, and these were outlined and taken from the climate change policy. Injury and mortality, of course, from extreme weather events. We just need to think about what happens when there is, let's say, a hurricane or a large flood, the risk of death, the risk of an injury or being injured, heat-related illnesses, heat strokes. It has also been shown that in terms of heat strokes, beyond heat strokes, high temperatures now are related to increased rates of heart failure and hypertension. So you may see people coming into the A&E with those symptoms. Respiratory diseases, such as asthma, waterborne and vector-borne diseases, think about floods and the knock-on impact, dermatological diseases, etc. Malnutrition and foodborne diseases, non-communicable diseases, because when there is when there is some sort of natural disaster or extreme weather event, persons cannot access their medication, and so their non-communicable disease control is basic, or there's an absence of being able to control it. Zoonotic diseases, mental and psychological disorders. We see that all the time when persons lose their home, they lose relatives, or they have to stay in shelters. Now the climate, just to summarize, the climate resilience Cayman Islands climate change policy speaks about a climate resilient Cayman Islands that promotes and sustains vibrant communities, a thriving natural environment, and a robust economy where people can live their best lives for now and future generations. This policy is key to proactively manage challenges through adaptation and mitigation strategies, comprehensively addressing climate action. Now, in this presentation, we're really going to discuss around the adaptation strategies, and the mitigation strategies will come into the infrastructure. So there are two arms, adaptation and mitigation. Of course, the policy is very broad-based, and I would have extracted the sections that related to health. But when we speak about us being net receivers of climate change, the adaptation is really key. The policy looks at robust economy, a livable built economy, healthy and resilient communities, and this is where health, it directly impacts health. Resilient infrastructure networks, looking at health infrastructure in particular. harmony with nature, and integration and coordination, the role of partnerships. And almost every speaker yesterday at the opening spoke about the role of partnerships, whether it was between technical cooperation agencies or between civil society or advisory firms or the insurance sector, banking sector. There was a lot of discussion around partnerships. So now we're going to get into the meat of today's presentation. And I would have taken an approach in using the WHO Health Systems model and applied it to the policy's guiding principles and focus areas. Now, this also was highlighted in the policy. What I've done is expanded on points in the policy and then provided suggestions moving forward on where there may be areas that the Cayman Islands and us in the rest of the Caribbean can possibly adopt and learn from. So the WHO Health System building blocks are as follows: leadership and stewardship. In particular, we will be highlighting the role of health systems governance, public participation and collaboration, and a multi-sectoral approach. Public participation and collaboration and a multi-sectoral approach go along with purposeful partnerships. Health workforce, ensuring equality and non-discrimination, inter- and intragenerational equity. We are dealing with a multi-generational cohort in terms of our human resources. We have baby boomers, we have Gen Zs, we have millennials like me, we have Gen Xers. We have like 4 generations of people with different learning styles, different working patterns, but all with the same aim. Digital transformation. We look here at hard infrastructure, soft infrastructure, and how do we really use the best available science and technology. Financing models, a lot of exciting discussions here, especially given the Cayman Islands' position in terms of being a banking center for financial services and insurance. Service delivery, clinical pathways, primary care versus secondary care, what is being done, especially when we have 2 islands like Cayman Brac and Little Cayman, and air routes, the relationship with, let's say, other islands that would airlift patients here, for example, the Turks and Caicos. Supply chain management. This was a very important component that we always discuss, but we really saw the importance of this component during the COVID-19 pandemic, especially for all of us in small island developing states. And even with Trinidad and Tobago that had significant purchasing power compared to smaller islands in the Eastern Caribbean, we struggled with supply chain disruptions for a number of reasons. And it was no longer about the ability to buy or the quantity that we were procuring, it was about routes. And then we'll speak a little bit about health infrastructure. So when we discuss health systems governance, the first key aspect of successfully implementing any policy that is related to an area such as resilience and climate change, in this case a sustainable healthcare system, is to ensure that there is political priority. And I'll start by saying, well done, I see the Honorable Minister here. Your ministry is the Ministry of Health, Environment, and Sustainability. So just in the name of your ministry demonstrates the political priority and the fact that sustainability has been placed under health and not, for example, in another ministry such as agriculture or so. So that starts already on a great positive for the Cayman Islands, and it identifies that inextricable link between health, environmental determinants, and overall sustainability. Now, a health systems governance approach. Basically, this current approach now, we speak about leadership and governance and then the role of partnerships. So the policy currently outlines the role of the government in priority setting for climate change through the Ministry of Health, Environment, and Sustainability, but then it's supported by other ministries. However, the Ministry of Health is the lead ministry. When we look at health systems governance, it's not just as simple as saying that the Ministry of Health or the government must lead this. Yes, the government does set the priorities, they do set the strategic plan, but then there needs to be partnerships because your health sector is multifaceted, not just in the Cayman Islands, but in Trinidad and Tobago. So there are public hospitals that I guess would fall under the HSC, which is similar to our RHA system in Trinidad and Tobago and in some of the islands. But then there's an extensive private sector network consisting of local GP-run clinics, as well as international players, So there's, Baptist, Health City Cayman Islands, doctors' hospitals. I'm just calling 3 names because those are the ones that come top of mind. But there's a very robust healthcare system and network comprising of public facilities, private facilities, international-based, local-based, and then there are the antecedent services. So there are private laboratories, small GP clinics, diagnostic centers. They all fall under the remit of healthcare. And this policy has to apply to all of them. Just think about something simple like, how do we dispose of biohazard waste? That applies to everyone, even if you're in a lab, if you're in an X-ray facility, if you're in a GP practice. It's not just the hospital. So we have to think very broadly. So there needs to be an understanding and there needs to be a level of equity. So we can't have one standard that a private hospital is held to, or a public hospital, and then it's not held to by another facility. So it has to be one standard that has to be decided upon, but led by the government and the ministry upon consultation. So there must be a clear strategic vision, and this has been outlined in the policy and, of course, by the name of your ministry. There must be participation and consensus orientation, and consensus orientation in this case will involve players such as the government, the private sector hospitals, the regulatory bodies, whether it's doctors, nurses, how you register your professionals, any academia or academic institutions that you work with, the insurance companies, financing agencies, because they're all involved in this entire process. And also, we must always consider the role of civil society and faith-based organizations, especially in the Caribbean countries where there is a lot of focus on religion and there's a voice that is given to the churches. Because this is where the buy-in comes for that strategic vision. And if you don't have buy-in from your population, if you don't have buy-in from your private sector, your financiers, and your NGOs, as good as a policy is, it will be difficult to implement. People have to have buy-in, and that's where partnership comes in and consensus orientation. There must be rule of law. There must be legislation with regulations, and on consensus, and when passed by the relevant governing bodies in Trinidad, we pass it through the parliament. There must be some sort of measures that can be applied if someone is, or a facility is in breach of. But of course, that takes a monitoring and evaluation perspective as well. There must be responsiveness, equity and inclusion, as I indicated. There must be consideration that what is occurring or the standards that a private sector hospital or a GP clinic are being held by in the private sector are the same as in the public sector. And the standards that you're holding a facility on Cayman Brac by should be the same as in Grand Cayman. It can't be different for them. Effectiveness of the measures. Measures must be feasible and acceptable. We can't apply measures that would be used in Jamaica or Trinidad and then try to apply it here. It has to be effective to this context and to this country based on the resources, the capacity, the capabilities, and of course your political strategic plan or your ministry government strategic plan. There must be intelligence and information, and the intelligence and information side really comes through your digital transformation journey. That is where the data will be collected that can inform business intelligence, not just in terms of epidemiology and disease trends, but for your insurance companies, which now can use that information to do their actuarial models, which would impact pricing, not just for Cineco, but also for your private service providers. But we'll talk more about that. Yes, I'm very passionate about insurance. I'm on the board of a private sector insurance company in Trinidad. And yes, so, and then there must be ethics. As doctors, we know, and healthcare professionals, that ethics is the heartbeat of our profession, and that we must ensure that all the measures and interventions that are applied are ethical, that they are fair and equitable, and they treat persons in the population as they should. Now, that is the overall governance that I would speak about in terms of those 10 factors that tie into health systems governance. But governance is not just out of the Ministry of Health. We have private hospitals, and private hospitals have boards. And those private hospitals and those boards must have in their strategic plan pillars that are aligned to sustainability, climate resilience, addressing climate-induced medical conditions, etc. The insurance and banking sector, and we'll speak a little bit more about that later on, they now have environmental, social, and governance goals that are tied into their strategies. How can those goals be applied to the health sector and not just in other areas? And academia is very important because this is where your research base is. And it was very impressive to read some of the abstracts that have been put out by students out there, outside. But universities and colleges, not only should they now include climate-related topics and modules in their curriculum and in their research, but also they now serve as a repository of information and can support ministries of health and private sector in terms of having persons collect data, store data, and analyze. They do help us a lot, I would say, at ministries, in our ministries of health across the region. So academia has to be involved as well in here. I always like, I guess because I was part of the COVID-19 response in Trinidad, I always like to include the media, because we saw the power, the immense power of the media. I see the ministers shaking and smiling because we know once the media buys into something, it works very well. And now we have all these different arms of the media. It wasn't like when I was a child and there was television, newspaper, and radio. So we always really should consider where the media fits in terms of how this leadership is taking place. Because again, when they buy in, the population reads, and they actually have a role in terms of self-awareness. So leadership and governance is extremely important, led by governments, moving along and aligned with the private sector and ensuring equity in terms of what measures are going to be implemented. And again, when we think about what we are implementing, we are looking at two arms. We're looking at climate-induced or clinical care of climate-induced medical conditions, that is your pathways, your diseases, and we're looking at the entire, all the supporting factors on them. Health workforce. This is an interesting topic because I think every Caribbean island speaks about deficiencies in healthcare personnel. Every island I speak to, and I have colleagues from Bermuda to Turks and Caicos to Jamaica to Trinidad to Guyana, Suriname, we don't have nurses. I don't know if they all come into Cayman Islands, but there are global shortages in terms of, for example, nurses and in specialist areas. And that's why we have all this movement of Caribbean people and persons from countries, even in Trinidad, from India, the Philippines, Nigeria, Ghana, that move back and forth, Cuba, to provide services. So we have to be very strategic with our health workforce and ensure that in the same way, every healthcare worker understands that when you have chest pain, that is an emergency, right? Even if you're a lab technician, even if you are the security officer, because healthcare workers, and we learned this again in the pandemic, are not just the doctors and the nurses, but they are the ambulance drivers, the laboratory technicians, the medical records personnel, and everyone in that entire loop, amongst others. So we need to ensure that every one of those persons in the workforce are made aware and understand the impact of climate change and what their role is in ensuring a resilient healthcare workforce. Now, we had a lot of discussions about AI, and one of the best descriptions received yesterday from Rebecca at Health City Cayman, it stood out to me, was her discussion about AI being an enhancement. And I thought that was incredibly profound because people always think that AI is there to take away their job. But she described AI as being an enhancement to your local workforce. So with people and culture, we need to ensure that they understand how to implement. They understand first and are made aware about the climate-induced health effects, but also the measures that need to be required for climate resilience. And that first starts with their awareness, their acceptance, and understanding, and then they are empowered. So there needs to be constant reminders that are not intrusive, but on your intranet, the ministry bulletins, the ministry website, reminders, the temperature is higher today, or it's rainier today, or there's a thunderstorm, look out for so and so, there may be flooding, and work and ensure that healthcare workers are aligned to that. Healthcare workers also must be trained. So it's not just about being aware, but they must understand the impact of climate change on health and healthcare systems through different modalities. And with the pandemic, we understood and we have now been accustomed to multiple modalities, and the modalities of care, modalities of teaching in terms of online and otherwise. And we need to introduce new cadres of staff in the healthcare setting, clinical and non-clinical, sustainability experts, climate change, climate health clinical specialists. And when we say sustainability experts, this is not somebody who's going to come and advise on greenwashing, But this may be someone who is a physician, or it may be someone who's an economist, a health economist, and understands the interlinkages between climate health, resilient healthcare systems, and the relevant indicators that are required. Climate health clinical specialists, our family physicians, our A&E doctors, our cardiologists must, our pulmonologists or respirologists, ICU doctors, must understand the impact of climate change. So, and as I said, in terms of the management structure in your hospitals, sometimes it's very important, or not sometimes, it would be very important and interesting to include someone who's a climate specialist or with expertise in that area on your boards. In the same way that lawyers are included on boards, we always have a legal person on a board and an accountant or a financial, someone who's an finance expert. We should really be including persons who have experience in sustainability, climate resilience, and the like. And they're not necessarily doctors or environmentalists. They could be economists, management specialists. Now, one thing I left out there, and I just want to revisit, in terms of the health workforce, we need to ensure that there's capacity building at the local level as well. All too often, we outsource services, and it happens even in a large country like Trinidad, or let's say relatively large. Trinidad's relatively large. See the Jamaican in the crowd smiling. But we need to build capacity within our country. There's only so much room that can be done in terms of outsourcing, so we need to build local capacity. And that is where government, again, can come in encouraging persons, giving them scholarships, bonding healthcare workers or local healthcare workers to really gain expertise and training in sustainability, in climate resilience measures for public health, and then bringing them back into the country. The third area I'd like to speak about is digital transformation, and this is where your business intelligence comes in, as we would say in the business world. And there are three main arms of digital transformation, one of which has been extensively discussed, much to my pleasure, and that is artificial intelligence. I'm not going to go into too much detail around artificial intelligence because there's been a lot of discussion around it, but then there's the use of telemedicine, which we saw during the pandemic, and even before that, and electronic health information systems, e-prescribing systems, e-diagnostics, e-health records. Now, there's another part of digital transformation, which is around hard infrastructure and soft infrastructure. And the hard infrastructure looks at your connectivity, your hardware, your software, your cybersecurity measures, whereas your soft infrastructure is around your training of staff. So the digital transformation, not only does it cut down on paper, but it also ensures that in the event of an extreme weather event, there is communication that can occur between different parts of the island. So I'm not sure what is your mobile phone coverage here, but I assume it's pretty high and above 90%. But for example, in COVID, we were able, during the pandemic, COVID-19 pandemic, Trinidad, mobile phones were one of the ways that doctors communicated the most with WhatsApp, believe it or not. They didn't have time to pull up on iPads, etc. They used WhatsApp extensively. But digital transformation is key to developing a resilient healthcare system. Firstly, because it allows the collection and collation of data through, for example, artificial intelligence that can be used to guide business models and health models, economic models towards health. Secondly, telemedicine, in the cases of extreme weather events, has been shown, once there is connectivity, to be a very useful measure in terms of communicating with patients and ensuring compliance. And of course, e-health records, prescribing prescriptions, diagnostics, etc., are important, not only because they cut down on paper and manpower, which is what people think, but also because there's a record that's stored in a cloud in most cases. What needs to be done is, at the health systems level, there needs to be supporting hard infrastructure like connectivity, software, cybersecurity arrangements, cyber insurance as required, and storage. We can all understand the disaster, I have to use the word disaster, or catastrophe, if a patient's medical records become open. It's like if your banking information now becomes public. So there needs to be a lot of emphasis placed on it. Overall, systems must be resilient, they must be adaptable, agile, and interoperable. We've all seen the challenges when one particular software system is started or being used, and then it's migrated to a different system, and there's an interoperability difference between either facilities or between the two systems and that whole conversion process. So digital transformation, as I said, is very key in this entire journey. It's also important for predictive analytics. If you have a supply chain, the digital transformation and using the systems like there's one, MS Dynamics, helps not just in terms of flow, but tracking your expired drugs, tracking drugs that are being used and their usage quantities. I mean, Jamaica has a really good example. They don't use MS Dynamics, but they use another system. So they are able to really identify in every public hospital and private pharmacy the levels of a particular medication, and they can even now move between pharmacies. And that is important in terms of resilience, because if there's an extreme weather event or a pandemic, it can now flag levels and arrangements can now be made, not just to procure more drugs, but if there's a situation where drugs need to be brought, air freighted from another country through a partnership agreement, it can be done. Okay, financing models. This is one that I really enjoy, and this is why I enjoyed this conference a lot, because there's so much partnership between private sector healthcare facilities and financial institutions, banks and the like, and insurance companies. So, if we are to ensure a resilient healthcare system, and we are introducing new measures, especially those around climate change, there must be financing to guide and support this. Where is the money coming from? And yes, the government does provide, but like in any project, and any large-scale project, you get funding from multiple persons or multiple agencies. So financing sources. Of course, there's from the government budget. There may be, I work with government, so that's why I always have to put that one first. There's lending that can be done, especially private sector, from commercial banks, and I know you all have many banks here. Multilateral agencies either support the development of proposals for loans or support, and the Honorable Minister would have spoken about the role of PAHO, CARPHA, WHO, development financing institutions that you may have relationships with, or through these multilateral agencies, philanthropic organizations, and I'll just put a teaser in for discussion in a few minutes about the insurance sector. So where does this money come from? There are a multitude of sources where funding can come from. And they all have to be aligned to which one of these sources will give us the best bang for buck with respect to financing this facility. Whether it's infrastructure or training of staff or developing new clinical pathways with an advisory firm that, or some sort of external support that may be required. Then we need to look at models, especially when we look at healthcare infrastructure. Are we going the route of a private-public partnership? Are we going the route of a government building a hospital and then bringing in an international operator? Or is it going to be built by government and supported locally by staff through an RHA or as you say, HSA? Or is it going to be handed over to an international operator or a local operator? And that needs to be determined, because basically private-public partnerships are about allocating risks to the parties that are best available. So the government might say, we have the land. I'm just using this as an example, no offense, Honorable Minister. But the government might say, we have the land and we have the capital, but we have international operators based here in Cayman. We want them to absorb the risk. They will provide metrics to us, and we will pay them accordingly. So that needs to be determined as well when we're financing, because that will guide the development of the loan. Then there are debt instruments, and what instruments are going to be used? Are loans going to be taken from your commercial or your DFIs, development financial institutions? Will grants be accessed from philanthropists or multilateral agencies, or through agencies like the UN OPS, which works through PAHO? Will syndicate financing be done between not just Caymanian banks, but international banks, for example, from other jurisdictions, pulling money together? Will bonds be used? There are blue bonds and there are green bonds. And in some cases, one model that we looked at in our hospital was that in developing the infrastructure for the hospital, financing for some of the green elements or the elements around mitigation measures like solar lighting, solar panels, etc., will access that financing came from one particular entity. So it's a group of different financiers that would come together. And there are blue bonds that are available for projects, say, around wastewater management, water conservation, that can be applied to your health infrastructure, as well as green bonds that are available for environmentally funded actions. The key here is to ensure that you don't greenwash. That means that when you're writing or doing your proposal with respect to, we are developing a resilient healthcare system, and in this case, we are building, let's say, a facility in a coastal area, primary healthcare or otherwise, and these are the measures that we are putting in place. We can't say that, well, we're going to put electrical conservation in. Yes, that's good. Or we're not going to use paper records. Sometimes people greenwash. Yes, those are good components, but that should not be all. So greenwashing is when you take one small component and it's basically amplified to appear as if it's this major intervention, to put simply. Now, there's also the concept of environmental, social, and governance principles, and that basically applies to the banking sector. Most banks in the region have signed on to the UN's agreement for sustainable financing. And in that agreement, they are compelled to provide ESG, environmental, social, and governance indicators. And they can provide, or they can have certain projects that are in place that align to healthcare that form part of that environmental, social, and governance strategy. So it's good, and through partnerships, if government and the private sector speaks to the banks and says, listen, we have an issue around diabetes management, let's say for children. Can you help us with an intervention where we give children and their parents with juvenile diabetes or type 1, when we give them monitors that you will fund, and then we will track the progress of their weight and their blood sugar and glycemic controls over the next 2 years. So the bank provides the instrument, the funding, the ministry gives the technical cooperation, the private sector may do follow-ups through their clinics and provide the data going forward with digital transformation, but there is an outcome. And so ESG indicators tie not only to the healthcare aspect, but also to the health aspect of it and a direct impact. So it's always important whenever you're having discussions in a private-public sector collaboration setting to ask about ESG or environmental, social, and governance alignments. The next part of the financing conversation is around insurance. So we always think about where do we get the money to pay staff and infrastructure and equipment, but then there's the insurance conversation, and how is insurance tied to a resilient healthcare system, especially in the case of healthcare resilience? Insurance is actually tied in two ways. We have the direct health insurance and life insurance aspect, and then we have the property and casualty insurance aspect. So we spoke about changing patterns of diseases, new and emerging viruses. We saw the impact on the insurance sector because of COVID-19, and in terms of life, etc., lives lost and mortality tables. So if there are differences and changes now because of climate change in health, in healthcare usage, and in the usage of utilization of healthcare services, it now impacts on your insurance claims. So it is important that insurers are part of this conversation so that the correct information is given to the insurers and their actuaries who now create a model, and that actuarial model is basically the business intelligence that is used to inform and price products, whether it's through your Cineco or whether it's through a private provider. I say Cineco because I met the CEO last week, and we had a long discussion about Cineco and its role. The impact now, in terms of a resilient healthcare system, the impact of the insurance sector would be not only in looking at the cost to government, whether it's through a public insurance scheme or a private insurance scheme, but it now looks at the coverage. So with climate change, there may be now new products that have to be sold. The actual coverage of services may need to be expanded or will need to be expanded to provide coverage. The deductibles might change. So there's a whole knock-on effect when it comes to financing that impacts the end user and the service provider, who would be the hospital. Then there's a discussion around property and casualty insurance. And here we're looking at health infrastructure. So where there are risks of, let's say, hurricanes and what we call cat-prone catastrophe or catastrophic-prone or cat-prone areas, the discussion has now emerged about whether traditional forms of insurance like property and casualty should be employed, or parametric insurance, which is a new form of insurance that's trigger-based. So parametric insurance is a little bit different from property and casual, because in property and casual, you have an event and an adjuster comes in and says, okay, this is what happens, and they go and they arbitrate and they discuss, and then you get your money about 2 months later, right? We had a flood, this is how much happened, this was your deductible. Parametric insurance is different in that you pay, but the trigger for a particular trigger, and that is based, the assessment of that is by a third party. So you get X million if there was a Category 3 hurricane that you paid for your hotel. Now, it may have been a Category 3 hurricane and you got 10 million, but the damage was 1 million. Or it may have been 15 million in damage and you got 10 million. But it's basically a trigger versus an adjuster coming in. So parametric insurance is seen as being trigger-based. It's seen to be fast and flexible. And that's, I mean, the quickest way I could explain the two traditional property and casualty and parametric. One is around having that typical claims adjuster coming in and reviewing, and he makes the assessment. One is around triggers that are brought in based on an independent third party, whether it's like your National Weather Institute or meteorologists, etc. Once they confirm that was a Category 3 hurricane, you are paid, damages or not. So the discussion now arises, and why we say financing, because if we want to build a resilient healthcare system, there must be payments and there must be some sort of finances that come in. Someone has to now cover these insurance costs. And in terms of property and casualty insurance, the question now is, should you go traditional parametric or should you use both? Should they complement each other for coverage? Of course, at another cost. So when you look at financing for a resilient healthcare systems, there's a lot of new considerations that have to be considered, not just in getting the actual funds to build a facility, but funding around looking at your staffing, looking at your development, the role of ESG indicators, the role of CSR in there sometimes in building capacity, and so on. Service delivery, revision, clinical pathways. So the physicians and nurses in the room would know about our clinical pathways when you come into an A&E and what are your SOPs that are required. But in terms of service delivery, clinical pathways will now have to be revised, including management of climate-related health conditions. Here I go back to health, in understanding how those pathways are. And then you would have your various quality indicators and metrics along the way that are to be measured. We spoke about the inclusion of insurance coverage for climate-induced medical conditions. And then we also need to look at measures to improve access to care during extreme weather events and natural disasters. Should the government and private sector invest in, for example, modular units that could be put into coastal areas? How extensive and how much funding should be put into telemedicine? Supply chain and procurement models. And this is a very interesting feature because, as I said, we didn't think about this much until the pandemic, when we realized that money wasn't necessarily the factor that inhibited us getting supplies. Now, extreme weather events impact significantly on supply chains. Recently, after I think it was Hurricane Beryl, there was a subsequent to Hurricane Beryl, the IT system in one of our shipping ports that brings medication into Trinidad went down at a supplier, and we could not get, I think it was Ringer's lactate, out of that supplier. So there was a hurricane, the IT systems went down, and that impacted on our supply chain. So now supply chain and procurement models, in order to ensure resilience, need to have adjustments that are put in place in terms of demand planning. We saw what happened during the pandemic as well. So what happens now is that if a lead time for, let's say, importing a particular pharmaceutical item or non-farm, be it gloves or, ECG equipment or, leads, whatever we would need, if that lead time was 6 weeks, now contracts need to be shifted to probably 10 weeks to ensure that it covers that sort of time frame when that medication should arrive. in terms of your minimum level stock ordering. Now, this is where the digital transformation journey comes in, because if you have proper functioning IT systems throughout your health system, you'll be able to do tracking and you make your adjustments. It also impacts contract management, because if a health care system is to be resilient, there must be a steady supply of medication at an appropriate cost. Because if the price is fluctuating, then it's not equitable and accessible to the population, especially in the public system. So there should be some sort of contract management now to lock suppliers into a price, because what happens is during an extreme weather event, they raise the prices significantly because there's demand. So if there was, based on your usage, if you locked suppliers into a one-year contract, now you might want to lock them into 2 years at a particular price to prevent price gouging and them raising the price, especially when you're looking at large-scale procurement for government. You'd also want to have arrangements and agreements probably with neighboring islands and others in the event that there was a shortage, so that you could import drugs in and share with them. And that works well in the Southern Caribbean. Sometimes we in Trinidad are short on a drug and we borrow from Grenada or St. Vincent, and likewise, or Guyana, and then we send. We do it a lot with vaccines. So building those partnership arrangements facilitated, say, by PAHO, CARFA, with the Ministries of Health, really helps and works. There must be some sort of revised logistics and alternative logistics in place to ensure island-wide delivery of medication, especially in primary healthcare centers, because they tend to be the outliers, whether it's in Trinidad or elsewhere. Health infrastructure. Now, the policy clearly identified, and when I speak here about health infrastructure, we're looking here at hospitals, clinics, primary care centers, labs, etc. The policy did identify sustainable waste management practices that are aligned to the circular economy, reusing, recycling, repairing, refurbishing, sharing, and leasing of buildings and equipment, designing health infrastructure to ensure resilience. And here we speak about upgrading your facilities and retrofitting and refurbishing, as what was done in the COVID-19 pandemic, to withstand extreme weather events, and introducing green technologies, renewable energy transition, emission reduction targets, etc. Now, when we think about it, we speak about all of these healthcare, all of these green buildings. What better model for a green building than a hospital? A hospital is a 24/7 operation. The impact of a hospital not running is that lives are lost. It's not an office building. So if we can get a hospital right in terms of it being an energy efficient, in terms of it being a master plan, in terms of looking at green technologies, we could get it done with any other building. So when we talk about wastewater management, I was a director on the board of Angostura Holdings Limited, and we used to discuss wastewater management from the production cycle. If we could manage, select wastewater from a hospital, and then reuse that water for non-consumption purposes, whether it's watering your plants, etc. Of course, you have to be safe with your wastewater because we have waterborne pathogens, etc. Consider the savings and the cost savings and the environmental savings that we're going to have there. Think about biogas production if you have in your hospitals, recycling CO2, decreasing your CO2 emissions, and using that energy now to do data mining and data storage. Of course, we do have features, and I saw it at Health City, Cayman Islands, and I have to be biased to them because that's the only hospital I've visited so far, that you have green gardens and green spaces in there that not only bring connection and wellness into places, but it's also a form in terms of having that sort of awareness, and also helps mentally with your patients and how they feel. So staff, there are many factors that can be applied: solar panels, solar heating, wastewater management, biohazard management, reducing your CO2 emissions into health infrastructure. Staff must be aware from them, your health planners in the ministry and whoever, when your scope is being done, it must include all of these items on the proposal. This is where the need for having staff that is specialized in this is required and is very important. But it also brings me back to the point about financing, because if one was to show a lot of these practices and these interventions, there are a lot of financiers that would be we're very willing to support them, as I said, through green bonds, blue bonds, ESG initiatives, etc. So in summary, I have used the Cayman Islands climate change policy to outline the adaptation measures and mitigation strategies and expanded on them to provide suggestions and revisions to address the multifactorial challenges associated with climate change. And here we are not just speaking about climate change, as I said, in green technologies in a building, but looking at the impact of climate change on the health of the population, as well as the entire healthcare system, which supports the health of the population. We have to ensure that as physicians, our goal, and healthcare professionals, our goal is to ensure the proper quality of care that is equitable and accessible to our entire population. There's also a measure of high quality that is required and business continuity, given the multifaceted arrangements within and interlinkages within the healthcare system. This presentation really aimed to provide suggested actions based on regional experience that can be applied to this policy's action plan. And to me, the take home from this presentation, if I wanted one item for everyone here to remember, would be the role of partnerships, because it's through purposeful partnerships, government, the private sector, academia, my friends in the media, I'm very friendly with them in Trinidad, they know me very well, the media, and faith-based organizations, your churches and other entities, and civil society organizations. I think we had quite a few here. I saw the Alzheimer's Association and quite a few others that are frequently at this conference. We need to understand that we all need to work together and collaborate in a meaningful way. It's not a competition of government against the private sector or allied healthcare workers against physicians. And it's only if we work together and we have purposeful and meaning partnerships will we be able to really have the successful implementation of a resilient healthcare system that will, of course, be part of our entire sustainable healthcare system. Thank you very much for listening to me for the past 48 minutes. And I really appreciate being here. So.